this time, there is no known cure for multiple sclerosis. For this reason, we look at ways of treating MS symptoms and ways of slowing the progression of the disease. I am not a doctor or a nurse. I'm just a woman with MS. After 5 years of avoiding pharmaceuticals, I relented to using them to slow the progression. I've tried all of them, and still my MS is active. I wish I would have had someone to tell me this information in language that I could have understood. I might have done things the same. No one knows. I just encourage you to take charge of your health and make informed decisions. In this slideshow, we'll share with you information about the available pharmaceuticals that may slow the MS progression. This information will help you make informed treatment decisions with your physician. The National MS Society believes it is important to get on a pharmaceutical therapy as soon as possible. Since 1993, medications that alter the immune system, particularly interferons, have been used to manage multiple sclerosis. Interferons are a protein that naturally occurs in the body. Cells produce interferons that, when invaded by a virus, inhibit replication of infected cells. Immunosuppressive drugs are written in blue and the brand name is written in red. Each of these drug therapies come with side effects. It is important to research the effects of these drugs and discuss them with your healthcare provider prior to making any treatment decisions. Remember, take charge of your health. Avonex. How does Avonex work? It's not known exactly how, but Avonex works by reducing the amount of damage the immune system does to the myelin, by mimicking the interferon proteins that are naturally occurring in our bodies. It is thought that Avonex works by limiting the immune system's ability to respond. Avonex is an intramuscular injection weekly. The side effects, Avonex side effects are weakness and flu-like symptoms. These symptoms usually last until a day after the injection and will lessen or go away over time. Beta-seron. It is believed that interferon beta-based drugs are beneficial because of their anti-inflammatory properties and their ability to strengthen the blood-brain barrier. Studies have determined that the BBB generally breaks down in MS patients, allowing increased amounts of undesirable substances to reach the brain. Beta-seron is injected subcutaneously every other day. The side effects of beta-seron are the same as with other interferon-mimicking drugs. Weakness, flu-like symptoms, and pain in the injection site. In most cases, reactions are minor and require little treatment. However, there are a number of potentially serious side effects that should be reported to a healthcare provider immediately, including depression, difficulty breathing, or frequent infections. Rebif. Rebif is also an interferon therapy. It contains specific interferon that is identical to the body's natural human interferon beta. The exact way that Rebif works is not known, but interferons are thought to fight MS by regulating immune cells outside the central nervous system, by stopping immune cells from crossing the blood-brain barrier and reducing inflammation in the CNS. Rebif is injected subcutaneously 3 times weekly. Rebif side effects. As I said before, with all the interferon-mimicking drugs, common side effects are weakness, flu-like symptoms, and pain at the injection site. In most cases, reactions are minor and require a little, if any, treatment. Call your doctor at once if you have any of these serious side effects. Copaxone is believed to work with your immune system by both preventing harmful immune cells from developing and simultaneously stimulating the production of beneficial immune cells in your body. These good Copaxone-activated cells then enter the CNS and help reduce inflammation and damage at the site of the lesions. Copaxone is injected subcutaneously every day. Copaxone is different than the other interferon-based drugs. Therefore, it has different side effects. It does not have flu-like symptoms, possible link to depression, potential liver damage, or effects on white blood cells or thyroid function. Injections themselves can have a fairly serious sting to them. They also can leave itchy, painful welts that can take up to 5 days to go away, which is the most common side effect. Copaxone can also cause fat atrophy, dimples. It's a destruction of fat cells in localized areas where the injection was received. This looks like a depression in the skin and underlying tissues, and it's permanent. When properly injected, dimples can be avoided. Tisabri. Okay, you know that T cells are the immune system assassins, and they find viruses and germs and kill them. It's thought in MS that T cells are confused and attack the myelin. Tisabri is believed to attach itself to the damaging T cells, preventing the T cells from recognizing and destroying the myelin. Tisabri prevents a majority of T cells from crossing the BBB and entering into the central nervous system. And even if a few of them get across the blood-brain barrier and enter into the central nervous system, Tisabri is able to migrate them away from the myelin, providing us with double coverage from the damaging T cells. Tisabri is a monthly infusion. Tisabri side effects. Tisabri increases your chance of getting a rare brain infection and usually causes death or severe disability. This infection is called PML, progressive multifocal. I have no idea how to say that, so I'm not even going to try. Gilenya is the first oral disease-modifying therapy available for the long-term treatment of MS. Gilenya is the first in a new class of immunomodulatory drugs called S1P receptor modulators. Gilenya blocks potentially damaging T cells from leaving the lymph nodes, lowering their number in the blood and tissues. It may also reduce damage to the central nervous system and enhance the repair of damaged neurons. Gilenya is 1 capsule a day. Side effects. Gilenya can cause your heart rate to slow down, especially after the first dose. Your heart rate will usually return to normal within 1 month after you start taking Gilenya. Macular edema, a condition that can affect vision caused by swelling behind the eyes. Reversible elevation of liver enzymes and infections. A slight increase in lung infections, primarily bronchitis, and herpes are also of concern. The first dose of Gilenya will be given in a doctor's office, where you will be observed for 6 hours for signs and symptoms that may be associated with decreased heart rate and other possible heart effects. While on therapy, your doctor will probably evaluate your vision during routine visits. These are the generic FDA approved immunosuppressant drugs and brand names that were in the market, as I started creating the slideshow. It is interesting to see that there are other companies who are using the generic drugs and listing them under another brand. It's important to learn about these drugs so that you can make an informed decision about your treatment. There are many alternative MS treatments that will be discussed in the next slideshow. I'm very excited to do that. I just want to remind you that the National MS Society believes it is important to get on a pharmaceutical therapy as soon as possible. And I say it is important for you to take control of your health.